www.healthcmi.com. Acupuncture continuing education online today. Acupuncture neck pain findings. So this was published January 2nd, 2021. Let's take a look. Acupuncture is effective for the alleviation of neck pain due to cervical spondylosis, a disorder caused by intervertebral disc degeneration. Researchers determined that electroacupuncture provides optimal therapeutic results when compared with manual acupuncture. Electroacupuncture produced a 96.67% total effective rate. Manual acupuncture produced an 86.7% total effective rate. Hello, I'm Adam White, licensed acupuncturist. Let's break down the numbers. Now, in the electroacupuncture group, 18 patients were completely asymptomatic after their treatment rounds. An additional 11 patients had significant reductions in symptoms and improvements of neck and limb functions as well. And then one patient did not have any improvements. So out of that total in that group, 96.67% total effective rate. But again, only 18 of them basically have been completely resolved. You had that additional 11 patients who got a lot better. But again, that's not complete. So total effective rates are not cure rates. The cure factor here was 18, a lot better 11. Again, one person didn't do very well. So not everyone is going to have that kind of improvement when they have neck pain due to basically arthritis, wear and tear of that neck, affecting the discs and even the facets of the joint. So cervical spondylitic radiculopathy occurs when nerves are impinged and there is subsequent pain, numbness, and weakness. They also broke it down into cervical spondylitic myelopathy, which involves nerve compression of the spinal cord, and numbness, tingling, extending through the arms, weakness, even balance issues, vertigo, and loss of motor skills, pain, and stiffness. And they also examined, in a subgroup, vertebral artery type cervical spondylosis, which indicates that there is degenerative process affecting the vertebral artery, and there can be dizziness, even blackouts when bending the neck. So these can be everything from uncomfortable to extremely serious. Even in the case when there is only dizziness from cervical spondylitic radiculopathy, loss of balance can lead to falling and injury. It can lead to problems when operating equipment, including motor vehicles. So even dizziness itself can be dangerous. The researchers break down the points into subgroups. So you have your people in general in the program. Then each subgroup was broken down into cervical spondylitic radiculopathy. So they had points like GB20, GB14, large intestine 4, etc. Another group, cervical spondylitic myelopathy, they had different set of points. And vertebral artery type people, they had a different set of points to get the job done. So they did allow some protocolization into subgroups, which was good because they're trying to at least mimic a real situation where you're making an actual diagnosis of the patient and then prescribing something based on their personal needs. It's not complete, no. Research needs to standardize to eliminate variables, so most research doesn't involve customization to the exact patient needs, but more general points for this condition or that condition, which is technically a semi-protocolized study. I'm happy with the research. I think it realistically shows the type of results that can be achieved. They also outlined the type of electroacupuncture used. What was interesting here is they were using 80 hertz electroacupuncture. I don't tend to see that. That was intermittent wave electroacupuncture. Typically, I see slower pace, certainly for low back pain. But for neck, sometimes we do see these higher frequencies. It was 20 minutes of electroacupuncture or manual acupuncture because they were comparing the two each day for 4 weeks. A lot of you say, wait a minute. Each day, well, yes, acupuncture is dose dependent. If we're going to go after something that's seriously degenerative, that whole 1 time a week thing is probably not going to get this type of result. You might get some results, but these are very good results they're showing here. To get that level of a cure rate, really going at it every day for 4 weeks is a great way to do it. I've seen a lot of research also get extremely high levels of result at a rate of 3 times per week for 4 or 5 weeks. So there are other ways to get the treatment to work without having to do it every day. But the more the merrier, really. I think every other day is superb. 3 times a week is excellent and offers an opportunity to get better. I should notice that the EXB2, so the Huatou Jiaji points, were used. And we are working on a project now to give you the whole history of the Huatou Jiaji points of the cervical region, because classical literature in Chinese medicine shows that the points that are on either side of the spine, about a ½ inch to an inch lateral to the spine, those Jiaji points really start at T1 and go all the way to the lumbar vertebrae. But in practical use, we also use them beside the cervical vertebrae. So in this case, they were using everything from C4 to C7, which they're calling Jiaji points. You may want to call them extra points, depending if you want to refer to classical literature or the modern nomenclature. And there is a long history to how that worked its way into standard Chinese medicine texts. But that has been a standard within recognized texts, the C4 through C7 included, of calling it Huatou Jiaji points on the neck now. So we really, acupuncture is ancient, but is also modern. So since the 1950s, the Jiaji points are really coming up on the cervical vertebrae. So I wanted to make that side note for those of you interested in classical Chinese medicine. Again, acupuncture, great for neck pain. Really a lot we can do with chronic degenerative conditions. Obviously, there's a lot more you can do. The proper pillow. People might want to get Tui Na massage or chiropractic. Proper posture, actually, very important. There's a lot of physical therapy, yoga, tai chi, qigong. There's so much that can be done in lifestyle to benefit the neck. Not craning towards a computer. The craning with a jutting of the chin forward is terrible for the neck. There's minor traction devices you can use at home. They're very simple and inexpensive. There's a lot you can do to benefit the curve of the neck. Some people even take to rolling up a towel and lying on the floor with the towel under the neck. But again, someone with a severe condition, that may hurt. And they may not be ready for even that. So it depends how severe. You can work with your doctor in terms of those types of exercises as well, especially in severe cases. However, acupuncture, nonetheless, is a powerful and effective tool to go after intervertebral disc degeneration-related neck pain and range of motion impingement. I'm Adam White, licensed acupuncturist. Thank you for listening. www.healthcmi.com